إذا كنت بتعاني من وجع مفاصل، عندك وجع بآلام العظام، مش عارف حلك، أكيد مثل ما عودتكن دايماً نقدم لكم تقنيات جديدة وحلول جديدة مع علاجات جديدة. كيف يعني؟ إذا أنت بدك الحل لعلاجك موجود عنا. شو هو حلك؟ اللي هو دكتور سليمان. موجود معنا دكتور جراحة عظام، رح يكون بضيفنا اليوم ويقدم لنا أحلى التقنيات وأروع التقنيات لعلاج المفاصل وعلاج العظام. خليكم معنا مع دكتور سليمان.
مرحبا، السلام عليكم. أنا دكتور سليمان، أنا دكتور العظام. أهلا. إيش بنسوي في العمليات؟ أنا دكتور العظام، نسوي في الإبرات for treatment for our patients. For example في الكتف، في الركبة، في الراك، في الساق. نسوي قبض عمليات، سويت في افتتاح عمليات. في الكتف ألم، في الركبة ألم، في البراك ألم، في الساق ألم. نطلع أول نطلع في إيش في هونيك نطلعه. فكرنا باكي we can need X-rays, sometimes MRIs, and take سوي these عمليات for the patient will be good. For example, hi, I am Dr. Süleyman. I am orthopedic surgeon. I want to talk about you for the orthopedic problems from the patients. What can I do? What we can do? For example, sometimes the people are come with us and they will say some from they have a pains or they have a problem from the shoulder, from the elbow, from the wrist, or from hip, from the knees, or from the ankles, or from the foot, from the range of motion of the ankles problems. We can do that from the joint surgeries. That's not only the joint surgeries we do. We can do at the first one we look to our patients. If their problems, we can do by treatment without the surgery. We do these surgeries without by surgery, by injections, or by physical treatments. For example, I want to talk about the problems from the orthopedic problems. What can they do? At first, I begin it from the up, from the down. For example, from the right, from the shoulder. Sometimes people they can't move their shoulders, or when they can do some cleaning or for some making the jobs, they feel the pains. Sometimes the pains, they wake up, they can't sleep or they can't move. It's very good. At first we look and we make examine it. What's the problems that come from the shoulders problems, and if, for example, for impingements, for rotator cuff, or for Bankart lesions, or for the arthrosis of the ankle of the shoulder, at the stages of that problems, we can do that therapy with the treatment by step. If it's the basic problem from the shoulders, we can do injected with ozone and plasma injection, PRP or CGF we call this in clinical area. We can do only without the surgery, by injection for treatment. And for example, the elbow problems, sometimes patients explain us from the elbows the pains and they can't take anything, they can't cover anything, or with hard working they feel the pains. But we can do at the first we look to sometimes we can do this treatment without the surgery by injections, PRP we called it, plasma PRP with ozone enrichment. We can do treatments for this, but sometimes this problems is the biggest, the stage of 3 or 4 the stage. Maybe the closet with arthroscopic operation we can do treatment, and we can for will be repaired, we can do this operation. And this closed operation, all joints from the body, for example, shoulder, elbow, or wrist, or hip, or knee, or ankle, all of them, we can do the closed operation, arthroscopic operation, that is calling. Sometimes the patient explains from the hand the pains, or sometimes or moving of the hands and tendons problems. We can do this without surgery or with surgery for patient will be feel the goods. And now, for example, some arthrosis from the joint problems, you know that's the cartilage problems. Sometimes in the hips, they can't walk in goods and they feel the pains from the hips. At the first, when we look, if the stage of the damage from the cartilage is not very big, we can do with stem cells injections, stem cells operations, or with arthroscopic operation, or prosthesis operation, tabdili mafsal operation we can do. And knee, sometimes the patient explain that from the upstairs or downstairs or walkings or sujud fil rukud, they can explain the pains. When we look at the first and we examine what is the problems, we can do sometimes and again without surgery, with surgery, closed operation, or with prosthesis operation, we can do this operation. Like an ankle. At the first, the big problem, at first we can understand the problems. We speak with patients and examine it, and we look, and we can understand problems from the joints or from her or him problem. What is this? And sometimes with nerve surgery we can do. What about the nerve surgery from the elbows or from the ankles, like a carpal tunnel syndrome or ulnar tunnel syndrome? That's about nerve problems. We can I am microsurgeon, and again only not joint surgeon. We can release the nerves for patients will feel the better, feel the good. And I can explain, for example, that's operation, for example, closed operations from the knees, arthroscopic surgeries, because, for example, meniscus problems or anterior circular ligament problems or any tearness from this, we can do this operation. Sometimes the patient have from the knees with a cartilage damage, patellofemoral chondromalacia, a little arthrosis, we can do the stem cell therapy. We take out the patients from the bone marrow or the fat tissue we take out, and we give the company enrichment to her or him. That's the stem cells and enrichment. When the enrichment and when we clean the area, we can inject for regeneration about cartilage will be repair, can be inject this operation. That's the all stem cells injections, stem cells therapies. That operation is in operation room will be done, must be done. For example, that's stem cells therapies or plasma therapies. At first, I explained the difference between it. For example, from the blood we take out, it includes the thrombocyte cells. That's thrombocyte cells for the bodies is the basic repairment cells. What we do, we take a one tube blood, approximately 6 or 7 millimeters, and we put the machine. The machine is CGF machine. We use the best from in 2022 from these years is the best machine for enrichment thrombocyte cells. We put the machine, the CGF machine. The machine is enrichment thrombocyte cells. Take out the CD34 cells and its enrichment, and approximately 20 minutes, and we take it out of spatial tube, and the enrichments, that's the thrombocyte cells, we inject in it ozone. You know the ozone, as we breathe the oxygen, ozone is activated the thrombocyte cells. And then, for example, we talk about if the problem, a basic problem from the shoulder, or elbow, or wrist, or tendons, or muscles, from the backs or the problems, basic problems, and from the hip basic problems or soft tissue problems, or knee spatial or basic problems, or ankle spatial basic problems, we can inject in clinical area. That's operation. This is not surgery. This is a basic after injections. Approximately in 5 minutes, the patient can go out and can go their homes. And this injection will be done 100 injections of like a plasma with ozone injection, CGF, CD, 34 injections are 100 injections, 1,000 injections, no any side effect, because it's include their thrombocyte cells, spatial from the patient, and it's include ozones. And that's no any side effect injections. Difference from the plasma with ozone, CD, 34 injections without surgery injections are different from the stem cell therapy. Stem cell therapy في العربي خلايا الجذعية. خلايا الجذعية is not like ozone with plasma injection. This is difference. That stem cells therapy, this must be done in operation room. Now, we take from the fat tissue, cells. It include the stem cells we take out. For this, it needs operation room. In operation room, it needs anesthesia, and we clean the joint, and then we inject that stem cells from the patients for treatment. And we can do, of course, from bone fractures, we can do this fractures operation, traumatic, with plate or with another with nails, and we can do these operations. And I can do operation that's tabdili mafsal, this joint surgery from the prosthesis operation I can do. Now, thank you. I want to explain about my job. What can I do? If you come in Istanbul, ahlan wa sahlan. We can together we'll speak for your treatment together, inshallah.